Chronic obstructive pulmonary disorder, or COPD, is a group of lung diseases that block airflow and make it difficult to breathe. Historically, COPD has been thought of as a man's disease, predominantly striking elderly men. However, things have changed, and today COPD is being recognized in women as well. Emphysema and chronic bronchitis are the most common conditions that make up COPD. Symptoms include shortness of breath, wheezing, or a chronic cough. Although damage to the lungs from COPD can't be reversed, there are treatments that can help. We talked to Ed Neuzil, board-certified advanced practice registered nurse at Allergy Sinus and Asthma Family Health Center, about COPD, what it is, and how it's treated.
COPD is one of those conditions that you can see in both men and women, but it has a tendency more towards the males. It's actually a chronic obstructive pulmonary disease. So this is something that goes over a period of time, and it can include things like asthma, chronic bronchitis, emphysema. So it's kind of a cover term. When we look at different problems like asthma, COPD, emphysema, a lot of what we do here is called spirometry testing. We actually measure your airway functions. And if appropriate, we'll actually give you a treatment of a short-acting bronchodilator and measure again. And by the difference in your airway functions, we can determine an appropriate medical protocol for you. Now, we also do something called complete pulmonary function studies. I have 2 individuals here that are certified on this machine, and it looks at things like lung volumes. When we look at things like asthma, COPD, that's an obstructive process. When we look at lung volumes, we look at more of a restrictive process. That's the fact that you just can't get a breath. It's kind of like being bear hugged or squeezed by a snake. It constricts you and restricts your ability to breathe. Another advantage of the complete pulmonary function study is we look at the oxygen and how fast does the oxygen get from your lungs into the bloodstream, because that really makes a difference. If you've got increased resistance, when you start to do something, you try to breathe more, well, you're going to get tired a lot faster. And then looking back at diffusion capacity, if your diffusion capacity is reduced, guess what? It takes you a whole lot longer to feel better too. So these are different things that we can look at to help determine what is wrong if you're not breathing appropriately. Nobody wants to have COPD, but the more they can understand about this disease, even before they have it, the more we can prevent the disease.
To get in touch with Ed Neuzil and the staff at Allergy Sinus and Asthma Family Health Center, please visit our specialist directory. Just click the Better Breathing story link icon on our homepage, yourhometownhealth.com. And a quick update. As we told you last month, the Allergy Sinus and Asthma Family Health Center is getting ready to open a second office in the village's town square of Brownwood, located right next door to the 2Js. The office is planning on opening late June, early July. We'll continue to keep you posted.